Hi everyone again. I know we are here somehow before lunch, and I know that we are pressed with time, so I will try to keep our presentation very short and touch upon the most important aspects that we believe need to be considered. We were asked to talk about artificial intelligence and innovation, tool to transform health systems. We do this in the context of a recently adopted new public health policy for the WHO European region with 5 mega trends, so to say, and 5 major aspects. I will not go into detail, but covering from the health security aspects to the aspects related with main drivers for health and non-communicable diseases, aging, really, and the importance of climate change and health, and really the use of technology. These are the megatrends which are included in this new policy, which you can consult on our website, and it's called EPW2, and I would recommend, if possible, that you really have a look. And it's a nice way to frame these initiatives and conversation around AI. We all know, but currently we are in the times of growing demand, workforce shortages, longer waiting times, digital fragmentation, and rising complexity. And these challenges are important, and they put a lot of pressure in the health systems. No matter how much money you put there in addition, because particularly in the EU, in general, all countries are investing more in health, but still they're challenged with facing challenges, with growing challenges and difficulties, and really comply with the demand from the population in spite of all the extra efforts that are put there. And this is, in general, true across the board. In the WHO European region, concretely, we are faced with chronic non-communicable diseases. They represent more than 80% of all premature mortality, and therefore, if you want to improve the resilience of the health system, we really need to look into chronic non-communicable diseases. But also there are other threats related with infections. There are, of course, demands, and people have expectations of having a more personalized, equitable, people-centered care. We talked about the shortages. We talked about the aging population. We here in Greece, we are delighted for basically almost 4 years that we are working with the Greek authorities and with the government on the establishment of the Athens Quality of Care and Patient Safety Office, and now and really trying to help countries implementing new policies in this area. And we are grateful for this support. With this support, we can not only work with Greece, but also support other countries across the WHO European region. Greece is becoming an important partner, even more important partner for WHO, and we are grateful for that. I see here people with the relevant responsibilities, both at the government and parliament level, and I would like really to express our gratitude to Greece over the board. There are structural weaknesses that we believe that AI can help overcome. They are of a structural, operational, technological, but also cultural nature. I will not go in details due to the pressure of time, but we believe that the modern health system should be able to work on predictions, anticipating and seeing where the trends are going. More prevention, more preventative. We all say that, but we don't do it in practice as much as we should. Without creating more inequalities, we can also ensure that it's more personalized and at the same time equitable. Increase participation, particularly from patients and their families. Interoperability needs to be improved, but also systems that learn and are really oriented to learning and to provide feedback. So we believe that AI in health is already transforming diagnosis and care. These are simple, obvious elements for everyone. We see progress in diagnosis and treatment. We see initiatives and we see evolution in predictive algorithms, for example, and we also see already actions around clinical decisions and support systems. So when we talk about AI, when I said before, when we were sitting there, AI it's a constellation of different things, and one should distinguish what we are talking about. And many of the areas in the health system can be powered and improved by AI, but we really need to know what we are talking about. So if you talk about prediction, it's completely different when you talk about tools, for example, that are going to help you improve your triage and waiting times and all of that. As the conference is very much focused on biotechnology, there's of course a very strong role by AI to be played at the level of genomics, personalized medicine for everyone. Personalized medicine for everyone. It's not the case yet. AI could maybe help us there. And of course, on remote monitoring technologies, huge potential there. Clearly great opportunities, we believe, in accelerating the digital transformation with smart patient records, with AI scribing, with personal health assistance. So there's many things, very many things that we can do. These digital systems can become the backbone of a learning health ecosystem. So the potential is huge in the context of course, risks, ethical elements, and really the human factor in control of the AI, which is always absolutely critical. Having this, really always thinking about that, everything we do should avoid that we increase inequalities. On the contrary, we need to help those in vulnerable groups to catch up quicker, to leapfrog, and this is where AI can really play a strong role, of course, always in the hands and with the leadership of doctors. So the human factor here is not going to disappear, it's going to be actually much more important, but we will leave time to do the real things that the human brain can do better than anything else. And that's really about what it's very exciting if we can do that. Of course, we need to do it the right way. I said in the beginning, when we were sitting there, that WHO in Europe has established a technical advisory group on AI with a strong focus on regulation, the role of governments, the ethics, and all of that. We really need to think about. Bias is a huge potential for AI, and the last thing we want is AI systems which are full of bias, and one could argue that at the moment there's a lot of bias. The Minister really talked about that, Dr. Themistokleous. So it's really important that governments do what's needed and right from them, but governments cannot lag behind too much. Governments are always behind innovation, it's normal, but they need to catch up very quickly in Europe. And probably that's not the case. Some people would argue that in other parts of the world, these things are going fast, and then in Europe we need to accelerate. So data protection, safety, and secondary data use is an important element to look into. Digital equity, I had a lot talking about that, and the ethics, oversight, and governance are very, very important. We also need to look into metrics and performance improvement, looking at clinical and quality aspects, systems efficiency, at the equity and experience. AI has a role to play in all of these potentially if we want. There's huge implications for us at the World Health Organization, but also international implications for countries and how countries work together, and the let's say, multi-country cooperation, which is something really important. WHO can play a role in these multi-country discussions and contexts, and therefore we here willing to work for Greece and with Greece in whatever you believe that that's necessary, and also to convey the experience from Greece, because I would like to commend Greece. You are taking steps in this direction already in a brave, let's say, approach to incorporating AI already into your health system, and that can come at the end of the day. If you're in the innovation seat, in the driving seat, of course, you will collect benefits from that at the end of the day. So WHO is ready to assist. This is what I would like to say. And congratulations to Greece. You're really embracing. You're putting it into practice. I think that your experiences certainly are being already observed by other countries. It's experimental moving forward, but deserves to be commended. In the WHO, in Greece, and as a result of the WHO European region, we also have, because our office focuses on quality of care and patient safety, we do have an innovative action plan where AI is also going potentially to play a significant role, and therefore implementing some of the policies that we have developed together is a great opportunity also using all of this. We have several initiatives in our office where these things are already being incorporated. Tomorrow we will be presenting one, for the first time, the new function, the new platform, which is called Health IQ, and we will be discussing it at the level of the ministry. But moving forward, we have also plans to continue to incorporate AI. So thank you very much. This is all very exciting. Congratulations to Greece for your recent efforts.